This is Joann Erenhouse again from Senior Solutions. We're the Council on Aging for Southeastern Vermont, right here in Windham County. And happy to be here today to hopefully remind everybody out there about some really good programs and benefits that are geared particularly for anyone over 60 or disabled. So let's jump right in. As you can see, there's a lot to cover, and this is the tip of the iceberg. So I don't want you to miss anything, so I'm going to get started. First off, what I'd like to let you know about is that Senior Solutions is in partnership in a grant from the National Council on Aging with Grafton County, New Hampshire. They put these grants together to get across state line cooperation and just get people working together. So we are known as a Benefits Enrollment Center, that we call it a BEC. And with that in mind, what we do is use the really great online tool provided by the National Council on Aging to screen people for like a gajillion benefits. Well, maybe a few less, but this has a wide variety of types of benefits that many older Vermonters and older Americans don't even know that they're eligible for. And rather than let the money just sit in the federal treasury, we like to see the people here in Windham County take advantage of some of the things that they really have already earned. So just to give you a broad overview of the type of benefits the National Council on Aging, the NCOA, can offer. Of course, general resources, but there's health assistance. And under health assistance, you get Medicare and you have Medicaid. These are different programs, but they're both federally funded. There's also prescription assistance. There's food assistance. Nutrition is a really big issue for people who are growing older and may have retired 25, 30 years ago. So their pension and their Social Security income has really not kept pace with inflation and the cost of living today. So with that in mind, the Older Americans Act has provided special funds to put aside so that the aging Vermonter can actually get extra money to help buy food. And one of those programs is funded, and that is the 3 Square program, which used to be called food stamps or SNAP. But this is a wonderful supplementary income program for people that need better nutrition. And I think you'll see on the screen at some point this really great picture with all the luscious fresh vegetables on it. I love that because in the summer and early fall, the farmers markets who participate will take somebody who's on 3 Squares, take their card, deduct $10 from their account, and hand back to them $20 worth of chips so that they can shop that day for $20 worth of food. It's a 2 for 1. It's a great, great way to maximize your shopping and to get good, fresh, wholesome food. Then there's also programs on utilities, whether it's helping you with electric bills, it's helping with fuel costs. That usually is a very popular one here in Vermont. So if you even think that you need to have assistance with your fuel this year and you qualify, get in touch with us because the money doesn't last forever. And while we're talking about it, as we go through these benefits, keep in mind we have a new local direct helpline number, 802-885-2669. And our helpline operators will be more than happy to help screen you, help set up appointments for you. If you can't come into the office, we have an office in Brattleboro, Springfield, and White River Junction. But we also have terrific case managers who will be more than happy to make an appointment, come in and see you, and they'll tell you ahead of time if you need any kind of documents. They'll sit down with you, bring you forms, help you fill them out, and make sure that they get mailed in, and they will track it to make sure that you get approved. Once you're approved, you'll be in our system, you'll be one of our clients, and when it's time for renewals, your case manager will give you a heads up and make sure that you get your renewal in on time so you don't lose your benefits. And that's something that most people, I know myself, I don't remember all the time when things are due to be renewed or have to take care of something, but it's a long way off. And by the time it rolls around, I have forgotten about it. So the case managers are extremely helpful and useful. So please take advantage of it. We also try to help with housing assistance. There's also, through the NCOA, income tax and legal support. We work closely with legal aid, and in fact, right now, the legal aid here in Brattleboro has an elder law project, and that's going to be starting a workshop in November for people who would really like to have help putting together their healthcare directives and other important documents that they need to prepare for the future. So call us at 802-885-2669, and we'll give you the contact to call legal aid. I think they have room for 12 appointments because they're going to sit with you and work through everything with you. And that's going to be on November 20th. So find out if this is something you can take advantage of and sign up. We'd like to help you. And even if you don't get in at that time, I'm sure that if you call legal aid and arrange for a one-on-one appointment later in the year, they'd be happy to help. We also try to support the transportation resources. We all know transportation in rural Vermont is a very sticky wicket. Most people that are getting older have to cut back on their driving. Maybe eyesight's not so good. Maybe you live at the end of a 2-mile dirt road in the winter, it's barely passable. Whatever the situations are, we don't stop wanting to go places. And older people do not only want to go to doctor appointments and the hospital. We all like to go to concerts, go to the library. We like to see our friends. We like to go swimming. There's a number of things that older people enjoy. They don't stop enjoying them just because they pass a certain date. So getting to these places can be problematic. But if somebody really has to go someplace, we'll try to help figure out how to get you there. We have the Current, which is very helpful, and sometimes they do have extra drivers. If you plan in advance, you may be able to secure a ride. There's also special populations that the Council on Aging helps to support services to. There are 2 here in Vermont that we provide special services for, and that would be the veterans and also for our Native Americans. So there's information about that. If you find yourself in one of those situations, give us a call and we will direct you to those resources. And while I'm thinking about that, we do have a special resource right now for our veterans, and that's our Vet-to-Vet Visitor Program, started right here in Brattleboro. A couple of months ago, the American Legion was experiencing, kind of a decline in people who are coming in. And we recognized that at the same time, and we met with them and together put together a terrific program. Our volunteer coordinator designed the program not for the American Legion, not for the veterans, but with and by the veterans, so that the program would provide the services they want. So right now we have a couple of really wonderful volunteers. We have people who are looking to get visitors because, let's face it, as you get older, Maybe some of your friends aren't around anymore. Your family might live out of state. And you get up in the morning, you get your shower, you get dressed. What are you going to do? Maybe you don't drive anymore. Getting a fellow veteran to be on a schedule with you so that you know that whatever days you pick, that person will come over and visit with you, maybe take you down to the American Legion for coffee hour. There's so many wonderful things you can do together. And believe me, it's not a charity. This is something that makes them feel good too. And it's truly, truly an extension of the buddy system that all of you went through in boot camp and through the armed services. And you don't have to belong to the American Legion. You don't have to belong to any specific organization. You just have to have been a veteran in any branch, male or female, whatever. This is something that we want to help the American Legion and the veterans enjoy growing older here in Vermont and staying connected to their friends and their community. And believe me, it's a pleasure. Everybody who has started into this program is just loving it. And we've reached out now to Chester, and there are several more communities that are just, I have to say, they're really itching to get started. The problem is we only have one coordinator, and she's amazing. And we do have extra help now here in Brattleboro, very nice help. And we have a Vista volunteer who is helping in Springfield. So I want to do a shout out to the commandants of the Brattleboro and the Chester American Legion, and tell everybody out there, if you're interested, give us a call, 802-885-2669, or call your American Legion and tell them that you've heard about this. And as soon as we get enough volunteers in each community, we'll be up and running all over. So thank you and good luck, and we hope that you'll take part in this wonderful program. We also have a friendly visitor program. You don't have to belong to any organization, you don't have to be a special age, you just have to be friendly and want to spend a couple of hours, maybe 3 or 4 hours a week, visiting with somebody who's maybe a little bit lonely and can't get out. It makes a huge difference because no matter how old you are, you need human companionship. We all do. And if you don't get it, you start to feel lonely. What happens if you get very lonely? You get a little depressed. And if you get a little depressed, you might stop taking care of yourself the way you used to. And that's because you just don't have that socialization. And in order to provide that, we have, oh my gosh, we have 20-some volunteers who are visiting other people, making friends with them, doing things, going places. And the program is really well organized by our coordinator, and she provides amazing support and training, and also a lot of appreciation. We can't say thank you enough to our volunteers. So if you're a friendly visitor, a vet-to-vet visitor, or a senior companion volunteer out there, I just want to say thank you very much. You know, you guys are the greatest. We couldn't reach half the people we do without our volunteers. So wanted to make sure you all know about that. And speaking of volunteers, you can also be a SHIP volunteer. If you're a professional insurance agent or something like that, you can't do it. But anybody who understands the Medicare system is welcome to call our office and volunteer to be a SHIP volunteer. Open enrollment is ongoing now until December 7th. And this is the time of year when everybody who's on Medicare should be looking at their benefits and figuring out if they have the right package for them. There are so many different plans, especially around medications. You need to sit down with somebody who understands the pros and cons of each plan and can help you tailor the right plan for your needs. This doesn't cost anything. None of the services that we provide cost anything because these are all through the government and through private grants. So I think there's one more here that I'd like to talk about also. This is the Home Meds program. This is a federal program that started a few years ago, and Vermont kind of jumped on last year. What a wonderful program. If you have any idea that maybe your medications are not making you feel so good anymore, it could be that you are taking some medications that are interacting poorly with each other. They could be causing side effects because today we all see multiple doctors, we all see different pharmacists, we travel around. So there isn't usually just one person who's scrutinizing your medications. Plus, you could have 3 prescriptions, fine. What about over-the-counter things that you've purchased through the years? Some over-the-counter drugs, some herbal remedies, some vitamins, all kinds of things that your doctor doesn't even know you're taking could be working together and not to your advantage. So we have this program. It's called the Home Meds program. We have a nurse case manager who will come into your home, make an appointment obviously, and she would like you to bring out all the things you're taking, whether it's ointments, over-the-counter, prescriptions. Maybe you have a prescription from 2 years ago that you should have disposed of, but you didn't because you think, maybe I'll have that pain in my neck again. Show her everything. She'll run it through the Home Meds program, and it will help scrutinize what chemicals are interacting with other chemicals in a bad way. She knows pretty much some of the trouble signs, but the best part is the results of this screening go to a gerontology pharmacist, and that person double screens it and will send the result to your primary care physician. Then you and your physician can sit down and he or she will say, I didn't know you were still taking this. Why don't you stop? See how you're feeling. Or, these 2 drugs really don't work well together. Perhaps we can substitute a different one for this one you're taking. Who knows? But that's for you and your primary care physician to figure out. We just want to give you the red flags because too many people end up going to the hospital because of these chemical reactions that we don't all know about. Your doctor cares about you, but your doctors don't always have the time and the resources to run this kind of a test or to keep track of everything. They're on a tight schedule, and you can't be too careful. This program is for anybody who's 60 or older, lives in Windham or Windsor County, and that's the only criteria. You don't even have to be a client of Senior Solutions to take this assessment. We will do it for you for free because we're concerned about your health. Now, there are lots of other things to talk about. One of them is under Medicare, you can get extra help with paying your Medicare bill. If you are low income, if you have a low Social Security income, but you're on Medicare, check into it and see if you can get a supplemental payment that will take care of what you are being charged against your Social Security. This could really help you on a monthly basis. Also, we have Respite Grants. We have, Meals on Wheels. This is very important. We don't provide Meals on Wheels. We get some of the administrative money and we try to spread it around to the senior centers and other places that provide the meals. It's not nearly enough. I can't stress that they receive very little funding for these meals. They have to do fundraisers and all kinds of things just to make ends meet. I wish we could give them more, but we don't get enough to give more. And we certainly would encourage anybody out there who would like to go to, say you want to go to a congregate meal site here at the Brattleboro Senior Center. They take a donation for the lunch. Give them a donation, because even that does not cover the cost of the meal. And it's a great service to people who can't get out of the house anymore, or even for a short time, say they had an operation. They can't cook or go shopping for, say, 3 weeks. They can sign up for Meals on Wheels for that temporary time period. The only requirement is that they're not able to get up and prepare food, or can't get out and shop for food, whatever it is. So we don't want people going hungry because they're not mobile. And I mean, I can't imagine how terrible that would feel. So the nice thing about the Meals on Wheels program across the board, they have a registered dietitian. And this person is available to any and every Meals on Wheels client to have a one-on-one consultation. I think this is a wonderful benefit. If you, are on Meals on Wheels and you're not feeling well, or you're not feeling hungry anymore, whatever it is, call our helpline, 802-885-2669, and get an appointment. Ask for an appointment, you'll get one, with the nutritionist. That will be wonderful to sit down with somebody who can explain to you what you should be eating, why you should eat it, how it can help you. This is something that I can't remind people of often enough. I think it's a wonderful benefit. The other thing I want to make sure I say, I know that sometimes it's really difficult to ask for help. We're very proud and we're very private. But nobody in this state or this country should go hungry because they don't want to ask for help. We, at one time or another, we all need help. And especially as the aging population is out in the countryside, separated, very little contact, maybe no transportation. And it's hard enough. It's hard enough to live in Vermont, in the country. How much wood can you chop? It's difficult to go shopping. It's difficult to do everything in the winter. And we here at Senior Solutions and the whole entire community, we care about each other. And this is not, let me say again, this is not charity. You have earned this. You've worked, you've had children, you've had maybe a farm, you've had a business, you have volunteered in your community, you've helped to build things. The least that the government can do is help you now that you're no longer able to earn a living, to get out and work. You deserve to be kept in dignity and in good health. And part of that good health is to have healthy meals. So please don't be afraid to call and ask. What's the worst? You have too much money and you don't qualify? That's okay. You never know. You don't know until you ask. And I hope everybody out there will encourage their friends, relations, and neighbors, whatever they need. Doesn't have to be food. Whatever it is that they need, call us and we'll try to find a way to get the help to them. We just had a great experience 2 weeks ago. The people up at Cover, they don't come all the way down here, but they came to Springfield. Cover built a ramp for a gentleman who has diabetes and lost a leg. He was having a horrible time getting in and out of his car and going places. Cover came down, and there was a doctor from the hospital. His whole team came down, and they built a gorgeous ramp for this gentleman, and he is so grateful. That's what community is about, and that's what we hope everybody here in Brattleboro will take advantage of and help each other. So I guess that's all I can say today. Probably said a lot, but I'll be back and bring you some more good news. Thank you very much. Bye now.